What's up, guys? John here. Titan Talk Tuesday in full effect. We're here for another beautiful week here at Titan Medical Center. Everything's been pretty good here. Everybody's healthy, thank God. We're here doing our essential work, trying to help people out around the country with all different types of things. Whether it be our hormone replacement therapy, medical weight loss, vitamin amino acid injectable therapies. We're also doing primary care for a lot of different things out there or people that need it. Some people's offices are closed down for their primary care and medical. They can't get prescriptions done. They can't see a medical provider. They have issues. We can help out with a lot of those issues now, and we do telemedicine, which means that you get online with a medical provider with your tablet, your phone, or your computer right in the comfort of your own home, and you guys can see the medical provider, have your consultation right there. Very easy, very simple, and the pharmacy will ship directly to your doorstep. So it can't be more easier than that, right, guys? And if you guys have any questions about things that we do or if we do them, you guys can always call or text 727-389-3220. So thank you guys for tuning in. We got a great show for you guys today. We're going to go over things like the therapy of the week, TA1. What is it? How does it work? How's it going to help you? Especially in this time right now of the coronavirus isolation. Thank you guys for all joining in. I appreciate you guys all joining in. We're also going to talk about slap tear. I've got one. What is it? What and how is it going to affect me? And what am I going to do to get over it, right? Wearing masks, curfews. So I don't know where you guys are in the country. We're in Tampa, Florida here. That's where headquarters of Titan Medical Center is at. And we have curfew, and they're going to start making us wear a mandatory mask, which is fine. CDC wants masks worn. I think it'll be positive. We'll talk about those things as well. And I want to hear from you guys. Do you guys agree with some of the laws taking place? Some crazy stuff is going on around the country, guys, like nutty stuff. I couldn't believe I'm hearing some of these different laws or executive orders by some of the governors in some of these different cities and states. So it's just nuts, right? So we'll talk about some of them. Maybe you guys can interact with me. Tell me what's going on in your state or where your hometown's at. We can talk about it, see what's going on, guys, right? WWE Essential. We'll talk about that. It's another great Florida thing that's going on here. Obesity and diabetes. Now, I hit on this topic last week. I really want to hit on this topic this week and tell you what you guys can do to be preventative about diabetes in particular, okay? And obesity and diabetes correlate together, so basically the exact same thing. So we'll talk about those things as well, right? So let's talk about that. Blood testing, discounts. We still have the special going on for you guys. Males $130, females $200, and that's a discounted price. Take advantage of it. Even if you guys don't feel safe to go to the lab right now, you guys can secure that lab for when this thing is over with. So you guys will have it ready to go. You already got the discounted price. Now you can walk in when you're nice and safe and comfortable and warm and fuzzy inside, all right? Or you can go right now. The labs are still open. All right. We'll talk about the Titan Corona Stimulus Package. So we want to stimulate our patients and our viewers out there. So I've got some free stuff that we're going to be giving away this week and next week. But I wanted to let everybody know about what it is, what it entails, and how it can help you guys out. All right? And we'll go over the poll question. The poll question was, what do you miss most during this COVID-19 quarantine lockdown? So we'll talk about some of the great things that you guys are missing, some of the things I'm missing. Plus, we'll give you the response to the poll and what everybody else is thinking out there that supplied the answer. So no further ado, let's get into it. So let's talk about TA1. It's a peptide therapy. TA1 stands for Thymosin Alpha 1. And what does Thymosin Alpha 1 do? What's its primary function? So its primary function is really, really cool. So what it does is it increases the number of T cells in your body. And then you're going to ask me, what are T cells? So T cells, there are two types of T cells. There are killer T cells and there are helper T cells. And you guys are going to say, hey, John, that's kind of scary. Killer T cells, are they going to kill me? No, these are actually good things for your body. So what they do is this. T cells, in particular, killer cells, track down the viruses, they track down the pathogens or viruses in the body or cells, and they hunt them down and they eradicate or try to take them out. They try to eradicate the negative cells or the bad cells, cancerous cells in the body, okay? And what it does is the helper cells come back and try to help alleviate that cell or try to produce better cells or helping cells for you guys. So this is really, really important, especially in this time right now with the coronavirus going out there. You know, this has been a big therapy for a lot of patients for immunity purposes. It's an immune system modulator. It makes the immune system stronger, being able to combat a lot of these different things that are out there. Now, let's talk about what TA1 was FDA approved for, or what it's on the market for, right? So what it does is it helps with vaccines and increasing vaccine as far as how good it works on the body. It's used in hepatitis B and C. It's used also along with cancer treatments. When you get, these cancer treatments, or basically you're getting radiation in the body, it kills a lot of the different cells in the body. So this will help along with that treatment. So it's a really, really cool peptide therapy, thymosin alpha 1 as an immune system modulator. That means it makes your immune system stronger. And it works by the T cells, the killer cells, and the helper cells. So I wanted to give you guys a little bit of background on it. Now, I did have our nurse practitioner, Cass, break down scientifically exactly what it does for you guys. And what I'm going to do is I'm going to launch that video tomorrow. So if you guys will pay attention to tomorrow's social media, I'll launch it on Instagram and Facebook so you can get the medical terminology as far as, or the scientific breakdown of thymosin alpha 1. Okay, guys? Because I like to break it down a little scientific, but in layman's terms. Because the average person is not going to usually understand what a doctor breaks down scientifically, or a nurse practitioner to a patient. They have to break it down in both ways, both in a scientific form and a layman's term. So I want to break that down a little bit for you guys here, but he will have a full entailed breakdown of thymosin alpha 1, okay? And that's also our therapy of the week, TA1, peptide therapy, right? So you guys are going to love this therapy. It's awesome, and you guys can use it not with just coronavirus, but with a lot of different sicknesses. So that's really good. Infections, it's really good. So thymosin alpha 1, don't forget it, and make sure you remember you heard it from me first, all right? So the next thing, let's talk about what I have going on. So, and you guys might have had this too. I've got a slap tear. So a slap tear is a superior labral tear from the posterior to the anterior, right? Or did I get that backwards? From the anterior, from the anterior to posterior. That means front to back. Okay, so I have a tear inside here, and basically this tear is in the labrum. And with this tear comes a lot of different things and bad negative things. So one, it feels like my arm is always locked up. I have limitation of where I can move my arm. Sleeping at night, it will bend down, like almost feel like it comes out of socket. Okay, so it's really uncomfortable when you sleep. I can hardly, like, the strength in my arm has weakened. Now, you were a baseball player, stuff like that, it's a very common injury. If you lift weights, it's a common injury. Athlete, you can do it with a jarring motion. And now there's different stages of a slap tear. I think I'm in stage 2. I just had an MRI. So that's one way to confirm if you do have a tear, is through an MRI. So I had some downtime. I did the MRI. I seen what was going on. Now I got to see how I'm going to treat it. Now, obviously, I've got all the great therapies at my disposal here. So I'm very happy about that. But it does say in literature you can do it non-surgical, or some slap tears will require surgery. I'm praying that's not my case. So I'm going to do everything in my ability with my therapies and with slap rehabilitation, superior labral tear from anterior to posterior. All right. And usually, like, I looked at what they usually do for this, and I talked to some of the orthopedic surgeons I'm friends with, and they usually have to put an anchor in there, and it looks like really uncomfortable. It looks crazy about what they have to do. They said it's really not that bad. I also have some bone spurs in there. I think I've had them for a while. The last MRI I had was probably like 6 years ago. I've had shoulder problems all the way from baseball through college and all that. And then obviously weightlifting, you might go a little bit too heavy on a bench sometimes, when you're younger, whatever it is, and an ego thing, and it just happens. So I've had this this restriction of mobility and all this stuff that I'm talking about for probably about at least 2 years. I've always worked through it. I've always tried to strengthen the different ligaments and tendons and muscles around the area to try to, increase mobility and increase it for stability purposes of staying in there, because it can't come out of joint. It's really crazy the way that your body is and the way it's built. But the slab tear is no joke, especially what stage you're at. So hopefully it won't get any worse. I'm going to rehabilitate it. I'm going to do all the therapies like BPC 157, TB 500, and Thymosin Alpha 1 along with it to make sure that I give myself every tool in my arsenal to help me recover without surgery. They say that the younger you are, the better to get the surgery, because the older you are, the harder it is to recover and the harder it is on your body to go through these surgeries. So that's why I want to do it, because I am 39 and they say at 40. So I had that number in my head. I'm like, man, I'm almost 40. I'm almost to that level where they really don't want me to do it, or it's going to be really bad when I do it. So I'm going to try to see what I can do. Obviously, I'm not going to get an elective surgery during the coronavirus, and it does affect my quality of life every day, but it's not an emergency, and I really don't want to go in the hospital right now if I don't have to. This has been a big thing with a lot of people around the country. I've actually heard from some of the cardiologists and stuff like that. They've had some people and patients come in their office, right, and had a heart attack. Literally had a heart attack. And they asked the patients, like, why didn't you come immediately? Because I didn't want to go to an emergency room and catch COVID-19. And they could have died from the heart attack. Instead they're risking their life at home because they might be having acute pain. That means like pain right away, like right now, acute pain. And it's happening and they don't know what to do, and they just want to fight through it. Some of these things, I guess you can fight through. You can bite the bullet and just be stronger. Some of the other things, you might need medical attention. If you need medical attention, you should A, call 911, or B, go to an emergency room. If you are going to go to the emergency room, get some gloves, get a mask, go in there, do what you guys got to do, because it might save your life, okay? But the slab tear, we'll see how it goes. I'm going to document my rehabilitation with you guys, the therapies, how I'm doing it, and we're going to see, is it really going to help the slab tear? Is it going to be able to come back without surgical repair? Is it going to heal itself, basically? There are a couple other different things like IGF-1 I can use, so I might use that in my arsenal too as well. But I'm going to document, I'm going to let you see what I'm doing. So if you come in this situation where it happens to you, you might have another option except for surgery. Because a lot of orthopedic surgeons, my buddy told me, he's like, they usually want to do a surgery on it just to get it healed and repaired. It really depends on the person, age, and their situation, what's going on. So I will tell you guys and update you guys about what's going on through this and see if it helps. And maybe it will. And maybe you guys are going through some of these issues or have this issue, and you guys can help yourself as well too. Okay? All right, so wearing masks in public and curfews. All right, so just recently, actually yesterday, Tampa instilled, it wasn't just a safer at home, it's a curfew from 9 p.m. to 5 a.m. Now, I got to ask ourselves, like, what's a curfew really going to do? If you don't have a curfew all day long, people can go out, they can go to the grocery store, they can walk their dog, they can exercise, they can do whatever they want. What's going to happen between 9 p.m. and 5 a.m. in the morning? There are some people that do like to wake up very early. I know some of my ex-military guys, 4:30 to wake up. They want to get up, they want to go run, they want to get their PT in and exercise and get it through the day. Even if they are in this corona situation, because most of those people are very regimented and in a routine, and they like to stick to the routine. If you throw them off the routine, they start getting a little antsy, okay? You don't want to get those guys antsy. But it's just something, it's kind of crazy, right? If you're going to have a curfew, I guess have it all day, or just for essential items, go out and get it. And they said basically, like, if you have to walk your dog, make sure you do it before 9 p.m. All right, that's kind of cool, I guess. You get it all done beforehand. If somebody has an emergency situation, obviously they said they can drive. They started saying here in Tampa they were going to fine people, and then I seen later on they recorrected themselves and they're going to talk to them to educate them. Because I just seen today, and I was reading about it, and then I see on the news today, I just could not believe it. So in Colorado, there was an ex-police officer playing catch with his daughter in an abandoned park. What did the cops do to him? The cops came up and arrested him in front of his daughter. That's pretty serious to do to somebody, and especially when it's in an abandoned park. I mean, there was nobody there. Nobody around him, no social distancing as far as problematic there. There wasn't, in a curfew as far as 9 o'clock. but this guy gets arrested in front of his daughter. Now, what did that police department do afterwards? They had to apologize. Once they found out this guy was a cop or ex-police officer, that probably threw some shade to him. And then when it got out to the public about this guy being in a park by himself playing catch with his daughter, that probably didn't look too good for them as well. So the over restrictions are not a good thing. Another thing I seen on there, and I don't like to bring up all this stuff, but I see it and I'm like, wow, this is kind of crazy. Florida's getting kind of crazy with some of the stuff, but it's not as bad as some of these other places. So I looked at Michigan. So Michigan's another place where you can't buy non-essential items now. So if you go into a Walgreens or a Home Depot, I guess, I don't even know if they're good for as far as non-essential. But if you go in there, if they have a paint section, a furniture section, or a gardening section, it has to be roped off. So that means you can't even go into it. So that's kind of crazy, right? You can't go purchase these things. So what if you're stuck at your home and you want to do some home renovations? You've never had time because you got to work all day. And at that point, hey, listen, you know what? I'm bored out of my mind. I want to repaint this room. I want to go grab some paint. You can't do it. What if you know what? Listen, I've always wanted to do a garden, especially with sustainability with food now. Maybe I want to make my own garden, plant my own food, and rely on myself. You can't do it right now. You can't even do this in the state of Michigan. If you have 2 houses in the state of Michigan, and I can understand this one a little bit more, but if you have 2 houses in the state of Michigan, you can't travel back and forth between those houses. It's either one or the other. And the reason is because they don't want to spread to one community to the other community. So I can kind of understand that. When it comes to buying non-essential items in a grocery store or a Walmart, that really doesn't make sense because you got everybody from the exact same zip code going there. And I talked about this. And they're all sharing that place right now. So that means that if I go in an aisle and I was COVID-19 positive, and let's say I coughed on my hands beforehand, I went and I grabbed the soup can to read the back of the ingredients because you always want to read the ingredients, right? And I'm reading on there, and there's something I didn't like in there. Oh, it has high fructose corn syrup. I'm not eating this. I put it back out. Now, somebody that doesn't wear gloves comes in there, grabs a can, puts it in their basket, then touches their face. Well, that could be a positive COVID-19 patient right there, right? Because that can happen through transferability. So at that point, we really got to look at some of the things that are taking place out there and say, hey, listen, you guys are kind of treading on my constitutional rights here, and I understand why, because of the health situation we have out there, and they don't want people to die. That's fine. But when you start breaking constitutional amendments and what our Constitution stands for, you got to take some sort of footing and some sort of place and kind of fight back against it to a degree. And for Michigan, a lot of those people are going to the state capitol and they're starting to protest. So at that point, if it gets crazy out of hand, the people need to take it back into their hands and really need to let people know, or their state representatives or the people that are representing their state, let them know this is not okay and we do not stand for this. It's just something I think, I think we need to stand up for it, because once your rights get taken away, you're going to be in trouble, man. I mean, they're going to be able to do anything they want to us, okay? So that's it. The wearing the mask, I totally agree with. I mentioned this, I think, 2 weeks ago. So before the CDC came back out with the new guidelines to wear a mask in public, they were saying not to wear a mask in public. And we kind of looked at the evidence here, and even from the medical perspective, we were talking to doctors and medical practitioners here, and they were saying that makes no sense, because we wear a mask because we don't want to get infected from somebody, or we don't want to catch viruses or germs. And that just doesn't go for COVID-19. Think about dentists. You remember dentists back in the day. There was a dentist that was actually doing a procedure on a patient, dropped his gum into the patient's mouth, was HIV positive, and got that patient positive. Now, that's kind of why they wanted face masks and all this, and that's, protective gear came in really to place. But protective gear's been there for people. We've had respirators for I don't know how long. Masks have been used forever. And then all of a sudden, the WHO and the CDC decided that they weren't going to do the mask. And it was probably because they wanted to make sure that the stock on N95 masks were there for medical professionals, because they need it the most, because they're on the front lines and treating this virus out there. But it's not right to lie or, to put your credibility up, for chance at that point. Now, are people going to believe you on this? Are they going to believe you on that? What else are you guys going to come out with? So, loss of credibility comes there. So wearing a mask, I totally agree with. I think people should wear a mask. Even our president, I think he should wear a mask just to set the example, because our leadership needs to set the example. And I'm not a political guy at all, so I don't even want to put it in political. But whoever our leaders are, they need to show us, and they need to lead by example. And that's anything that you do. That's what I try to do for Titan, and any other CEO or other leadership out there should do for their people, basically. Whether you're in the army or business or you're in politics or whatever it is, your leadership should set the example and set the precedent. So wearing a mask, I think, will help a lot of people, and will definitely slow the spread, and we'll try to probably keep you guys healthy. So that's a big one. The curfews and all that, it's getting out of hand, man. So we'll see how it goes. Florida will hopefully open up faster, and our country will hopefully open up very soon all around the country, and we'll get back to work, and we'll get back to being good old-fashioned Americans, okay? Just with a little social distancing and all this other stuff. Hopefully being a lot cleaner. Cleanliness is next to godliness. So the cleaner you are, the better, guys. Remember this. So even when we get out of this, make sure you're washing your hands, especially if you have to go to the bathroom, okay? But washing your hands, and doing some of these different things to practice better hygiene. I preach this to my son all the time, too, all right? I just touched my face with my knuckle. All right, so do you agree with any of the laws that are taking place? That was one question I want to throw out to you guys. I'm sure you guys, I talked to you guys all around the United States. And at that point, do you guys do it? I mean, are you guys abiding by the laws? I know some of my people like Jeff Bahari's in California. I've got some different people in Pennsylvania, here obviously in Florida and stuff like that. So at that point, are these laws any good for you guys? I mean, has it been working, you think? Is it good? Because I definitely seen now in Volusia County, they had the police, and basically at this point they want to keep their police safe. So what they did in Volusia is instead of the police patrolling beaches, they've got drones. And who was doing drones first? China. So China was doing drones, and they had an intercom system on these drones, and they would see people. If they didn't have a mask on, put your mask on or go home immediately. Social gathering, get away from each other. At that point, so this is what Volusia County's been doing, and you'll probably see it rolled out around the United States. So they were doing the beaches like this. Now, where this kind of breaks, within our rights, is they were doing it for homes too as well. If they thought or they got a report that somebody was doing a social gathering, more than 10 people, then they launched these drones in the neighborhood. And they went into people's backyards and actually broke up some of these gatherings. It's good they broke up the gatherings, but, privacy comes into play here. They're not supposed to be able to just go right in your backyard. Now they got a drone, and they're watching and recording you guys. So at that point, we got to make sure that our rights are not trampled on here, and there's some kind of line that they don't cross. I mean, 9/11 was a big example to us. We gave up some freedoms for 9/11 because we wanted to keep our country safe, and the people thought it was a good idea because we wanted to keep ourselves safe. All right? But this right here is a little bit different than 9/11. It's not some people that we have to worry about bombing us. We actually have to worry about a virus, which is invisible, and we should have to worry about our government or state law, overtaking our rights. So just watch out for that, okay? All right. WWE, World Wrestling Entertainment, essential? So have you guys seen this? If you guys aren't in Florida, I always watch the news, especially here in Florida. I like to see what's going on. The WWE is now, they're rated as essential. So the governor, DeSantis, first put WWE as a non-essential. And what happened was somebody went into DeSantis' office a couple days ago, and at that point they changed their mind and they came out and said that the WWE is essential. So I don't know. Listen, I have a lot of WWE friends, and God bless them. I hope, I think every business is essential. Every worker is essential. I mean, from our workers that are, at the register to Uber Eats drivers to medical workers, if you're in some other industry, you're essential, man. I mean, this non-essential, essential thing, I totally understand why they're putting these name tags on people, but everybody's essential, and all workers are essential for our country. Because look at us now. Our country's going down the drain pipes economically, and that's because all the workers are out there because they're essential. So the WWE, it was kind of a big debate I seen. A lot of people getting crazy about this. I don't know how I feel about it. if they're getting tested, all the wrestlers and stuff like that, I don't think it's a problem. Some people were complaining because they're not doing social distancing, the 6 foot away from each other. They're up each other, slamming each other, sweating on each other. Is this a problem? And if they're all tested, hey, listen, I don't think it's a problem. If they got the immunity test, I definitely don't think it's a problem, because if they've already been tested, and let's say they've already had it or not had it, if they've got the immunities to it, then God bless them, man. So at that point, it was a big debate here in Florida. It's still getting a lot of traction as far as that goes, with people complaining about it or being on the side of it. So just let me know what you guys think about it. WWE Essential. And it's pretty cool. They're doing it. They're recording. They want to provide entertainment for people, and everybody's in their house. So I understand, because people run out of things to watch. I've talked to some people that have not watched TV in the last 5 years, and they can tell me everything that's on Netflix. All the new movies are out on Vudu or whatever streaming service online you might watch. So it's kind of crazy to hear from them. And I get to talk to them because I'm a movie buff. I love movies. I love these TV shows. So at that point, they can actually interact with me on some of these different things, or they'll bring up some funny comment on a series or whatever it is. So it's pretty cool. But we are definitely running out of things to watch. Depending on how long this goes, hopefully, the way it's going is we're going to be out of this May 1st, as a rolling start, is what Dr. Anthony Fauci said, a rolling start for the country. Hopefully we'll get into that quicker. We won't know till then, right? All right, so diabetes. Now, I've pressed on diabetes and obesity these last 2 weeks harder than ever. The reason is because if you have diabetes or you're obese, you are at a higher risk to die from COVID-19, okay? So this is pretty serious, because over half our country is obese, and 33.2 million people have diabetes. We went over this chart. I put it up last week twice on Titan Talk last week and on Titan Lifestyle with Big Drew, because I thought it was really important. And they correlate together. Usually obese people have diabetes or pre-diabetic. So at that point, you don't want to be in either one of those categories if you don't have to be. And you don't have to be obese to have diabetes or be pre-diabetic. I want to let you know that too. So don't think, hey, listen, I'm skinny, I don't have diabetes, or I'm not pre-diabetic. Listen, there's only one real way to find out if you're pre-diabetic or you have diabetes. And this is where my point comes into play. You should get a hemoglobin A1C test, which is a 3-month average reading of your blood sugar levels. All right. A lot of people get a glucose test with their regular primary care physician. Now, the glucose test is a good marker, but a glucose test fails in a lot of aspects. The first reason, you have to be fasted when getting the blood test and to get a proper glucose level reading. Okay? So if you're not fasted, that reading can be skewed or off. 2, a glucose reading, right, is only going to tell what your sugar level is that day. So let's say it is fasted and you are 2 points above a high level. All right, you're only 2 points above the primary care. It's not a big deal. It wasn't crazy. You could be having an average higher glucose level or sugar level through the day or later on in the day. Or as an average over 3 months, it's going to show you. The best thing about a hemoglobin A1C test is this. It doesn't matter if you've ate or not, fasted or not, you're going to get a correct reading on your 3-month average of your blood sugar levels. And this is going to tell you the information that you need. Are you pre-diabetic? Do you have diabetes? Where do you fall on the scale? At that point, you can be preventative or you can treat the current problem. You can fix this problem in a lot of different aspects. One would be diet, so you guys can have a diet change. Exercise. You see how these things correlate? And with diet and exercise, usually you'll start slimming down and your health will become better. So this is a fact. The better you are in shape, usually on the outside and inside, the healthier you are, okay? Now, I've seen a lot of guys do some stuff and get their outside and they look like a Ferrari on the outside and like a Pinto on the inside, a real beat up beater on the inside. So you want to make sure that both the inside and the outside reflect on you being healthy. Now you can look at yourself on the outside and be like, listen, I got a 6-pack, I look good, everything looks good, everything's fine. The next thing to do is do a blood test for for certain major organs like liver, kidneys, do a hemoglobin A1C. You can test also your hormones, make sure they're dialed in. There's a lot of different things you can test for. But the main vital organs are the ones to really look at first and then dial in the rest of the different things, okay? And when you have those dialed in, you're going to feel better, you're going to look better, and you're going to perform better. What Titan Medical Center says we do for you, that's what you should be feeling like. All right, if you're not with Titan and you don't feel like that, you better get with Titan, okay? So it's real simple. If you guys want to become a patient, you guys can call or text 727-389-3220. Now, another thing that I'm going to do, I'm going to have this contest that I talked about, the Corona Titan Stimulus Packages. And I'm going to have multiple packages like the government's doing, but I'm going to deliver quicker because I know, some of these loans haven't been delivered. Unemployment's not getting delivered. I feel bad for a lot of my people in the state of Florida. They're getting the runaround. So if you guys have great unemployment in your state, God bless. A lot of my friends are in the in the service industry, entertainment industry, and they're not getting any help. So at that point, boo on them and boo on that system. They need to get that fixed. With all the money and budget and everything like that, those guys need to get those systems fixed. And it's not too hard. If they need a website guy, I'll get them one, okay? It's not hard. So they definitely need to get a wrap around those things. But the stimulus package, the Titan Corona stimulus packages. So the first package is going to be this. The first package is you will get a Titan Medical Center t-shirt or leggings if you're a female. And you'll get Purell, right? Antibacterial, geez, oh Pete's. Sanitizer. Yeah, I don't even got a Purell here, but here's one of the sanitizers that do go out from the pharmacy. So you get hand sanitizer, a Purell one, not this one, and you'll get a t-shirt or leggings if you're a female. So that's an awesome package.
Yeah, a shirt and a bag over there as well.
Yep, a shirt, bag, and you'll get the hand sanitizer to go along with it. The next stimulus package, because there's always better ones, right? We always got to do better stimulus packages. So the next stimulus package is this. You will get a free consultation visit with the medical provider for an immune system boosting therapy. That could be vitamin C, zinc chloride. It could be a number of different ones that we offer to you guys. But it would probably be in those three. So Nectar of the Gods, glutathione, vitamin C, or zinc chloride. There's 4 to choose from. And you guys will be able to get one of those therapies. As long as your health and everything's fine, which it should be, you guys will be able to get this. So you'll get a free visit, and you'll get a free immune system boosting therapy. You cannot go wrong there, guys, okay? These are like $300 or $400 packages that I'm giving you guys for free. The third stimulus package from Titan Medical Center. You will get a signed Titan book as far as the Health Bible, which me and Jeff Bahar wrote. Your guide to disease prevention, anti-aging, and weight loss. You'll get that along with a free Titan program subscription. So what that's going to give you is meal plans for 12 weeks, exactly what you guys should do. You guys will be able to pick what plan you want. It'll give you the guidelines of what you should eat every day, along with a training program. And we even have home training workouts in that program. So you guys can do these at home. And I don't even know if we have weights. Might have one set of dumbbells. But there's a lot of different exercises in there you can do without dumbbells, okay? So you guys will be able to have this. So 3 Titan stimulus packages. And they're going to be given away this week. I'm going to create different flyers for them. And next week, I'll give away 1 this week and maybe 2 next week. So this week and next week, I'm going to give away these packages. I will have the graphic up on social media. So Instagram, Facebook, I'll have it up. You guys need to share that. You guys just follow what the post says. You guys will be entered in to win one of these Titan Corona stimulus packages. Let's go over it again. The first one, you'll get a shirt, a bag. You also get, well, if it's a girl, you guys can get leggings. You also get some hand sanitizer, Purell. Name brand hand sanitizer. Can't find it nowhere. Sold out in stores. You'll get that for free. The next one, you will get an immune system booster therapy package along with a free medical provider consultation for that package. That is a win-win. The third one, you'll get a free health Bible, the Ultimate Health Bible, your guide to disease prevention, anti-aging, and weight loss, written by yours truly and Jeff Bahar, along with the Titan Fitness programs. That's a 12-week program of your training, all laid out for you, all the exercises, everything you should do with your meal plan. Everything you should eat, how you should eat it, and the meals you should be eating and what you should have in those meals, okay? So 3 packages for you guys to all win. Hopefully you guys, I hope you guys win, whoever gets it. You know, I will sign the book for you guys too as well if you win that stimulus package. And then at that point, you guys will get something free out of Titan Medical Center. We want to get back. Remember, we have specials on medical consultations right now. We do primary care if you guys need it too, as well as all the other things that we do. If you have any questions about any of these packages, any concerns, call us 727-389-3220. You guys can also text the line. All right, Titan Medical Health and Lifestyle Show this Sunday, ABC. We go back to our original time at 11:30. So if you guys are in the area, you guys will get that. I still got to post this one from this last week. It was a great episode. I want you guys to check it out. Give me some feedback. Tell me how much you guys like it. So I appreciate you guys all tuning in to Titan Talk Tuesday. It's been awesome. I'll see you guys Friday with Big Drew, Titan Lifestyle. And don't forget, Titan Medical Health and Lifestyle Show, Sundays on ABC, and I'll post them on social media for you guys. Thank you guys for all tuning in. I appreciate you guys. Love you guys, and thank you for the support.